You may recognize my next guest as Dr. Max from CBS or NBC. This Cuban native born in Havana graduated with honors from Princeton, earned his PhD from Wake Forest University School of Medicine, and was an NIH postdoctoral fellow at the Rockefeller University. He's earned multiple awards, including 9 Emmys. Welcome, Dr. Max.
Hey, Maria, I'm glad
And
to
you're
be
a
here.
friend.
Yeah.
Max, you also met the Pope.
I did. I've met the Pope, actually, both of the popes, both Benedict and Francis, because I helped organize and moderate the scientific conferences on stem cells and cellular therapies that were co-sponsored by and held at, believe it or not, at the Vatican. And so that's when we had a chance to meet actually the last, the previous Pope who is still alive, and Pope Francis. So we've done these under their auspices at the Vatican, no less.
Wow. And is that after you authored the book? Your book is called Cells Are the New Cure.
Right. That was, actually, the book came out sort of in the middle. We've done 4 of the conferences. We're in the process of putting together the 5th one is coming up now at the end of May.
Right. I'm coming to that one. I'm holding Dr. Herreri to that. He said
assuming that, the coronavirus doesn't blow everything up on us. But we pulled the book out, or wrote the book rather, as a result of a lot of the information that came out of the first 2 or 3 of the conferences, because there was so much information there based on stem cells and then cells kind of writ large, not just stem cells, but other cellular therapies that are really going to change the way I think medicine is practiced in the very near future. It's already happening some, but it's really going to change the way medicine is practiced.
Right. On the way over here, I was reading that stem cells are already being explored for the coronavirus, now COVID, or they even changed the name again.
Right. COVID-19 is the name that they've given. That's the shorthand that they've given sort of the disease. It's the novel coronavirus something 19 or whatever.
COVID-19.
But, yeah.
And they are going to, there's 80 clinical trials taking place.
So they're looking at a lot of different things. For this, the most important thing they need to do really is first contain it and prevention. Vaccine is going to be a ways away still. That's at least a year and a half away for a vaccine. And treatment, they're starting some trials on antivirals, but even that we don't know what's going to happen with that. So there's a lot of stuff that's happening, but we'll see. I'm not sure what's going to happen with the coronavirus.
Well, we'll get back to that. Yeah. I want to talk a little bit more about you. You were born in Havana.
I was born in Havana, Cuba.
Was your father a physician as well?
He was.
You were a PhD.
Right, and my dad was an obstetrician and a gynecologist, and he then came and did some of his training in the States. After he graduated from the University of Havana, he did some of his training in the States, and then decided to stay after. I was born in Havana, but we came to the States when I was only about a year or 2 old. But because my mother worked for Cubana Airlines, we used to go back and forth. All the family was still in Cuba, so we'd go back 3, 4, half dozen times a year. In fact, you asked me to bring this, and I have it right here. This is my original Cuban passport.
Wow.
I won't tell you how long ago, but this is me as a little infant baby, and I've got more international stamps in this.
Wow, I'll send a close-up to Cheyenne Reed later, and
I've got
we'll
more stamps in this passport, I think, than I've accumulated ever since. So.
Wow. Well, I had just asked you if you know Liliana Bravo, Jose Diaz-Balart. I mean, you mustn't. You probably
we run in.
have a lot of mutual.
It's all some of the mutual friends.
Mutual friends. So, is that what got you interested in medicine in the first place? Your dad?
Probably. I mean, I think I always sort of had that interest, and of course, every little boy always wants to kind of emulate their father. But it was interesting. Early on, he said, if I had to do it over again, I wouldn't go into medicine, I think meaning practice medicine as a physician.
Oh, interesting.
And even as long ago as he was doing it, I think it had to do with the fact that I think he saw some of the early handwriting on the wall that medicine was going to be, there were going to be more people telling you what you should practice, who you should practice it, who you can practice it on, what you can charge for it, and so forth. I don't know how he was able to have that crystal ball to see that. But I think he and then most physicians of that generation and even more of my generation are just not happy with the way medicine has gone these days. But that's another story.
He was
It's
more
still-
patient-focused and saw all
Yeah,
of the
he just-
administrative and all of a lot of
all of that
physicians.
business end of it. That
business
I think
end of it
just
that he didn't
wasn't
like.
happy with it.
Right, and then you, how did you get into broadcasting from there?
Well, I got my PhD in neuroscience from Wake Forest, and then I came to New York as a postdoc at Rockefeller University. I'd been there for about 2 years, and I did 2 years on my grant, had about a year left on my grant. And I was running out of school to go to. I was going to have to be a grown-up and get a real job. And I didn't think that I wanted to, poke rats with electrodes for the rest of my life.
Okay.
And I did radio as an undergrad at Princeton. And it was actually both my professor at Wake Forest and a classmate from Princeton said, you like science and you did radio, why don't you try to do science and television? Okay, that sounds like a good idea.
Okay.
Went around, talked to a lot of different people. Everybody said, we think that's a great idea. We don't know how you go about doing it, but let's give it a try. So I went around and spoke to a lot of what was then still the Old Boy Network. Now it's the Old Boy and Girl Network, but back then it was still the Old Boy Network. And they all said, yeah, we think it's a great idea. I'm not sure how you do it. But talking to somebody connected with a news director who became a lifelong friend and a mentor, who said, you know what? It makes more sense to take a scientist and teach him television than to do it the other way around. And then I got
Remember Bob Ezell? Was he around then?
Bob, I don't know if he had started just then.
Right.
Art Uleen was around.
Uleen.
There were a couple of others, Frank Field,
Yes.
who I became friends
Yes.
with later on. They were all around, but it was a very small group way back then.
Interesting.
It'll be 40 years in a couple of months.
Wow.
Believe it or
Wow,
not,
that's
yeah.
amazing.
Yeah,
That's
yeah,
a
yeah.
longevity award in itself. So getting back to the stem cells, what made you write the book? Why do you think stems are the new cure?
Well, let me tell you, cells in general, because I think pretty soon, when you go to the doctor, you're not going to get a prescription for a pill or a capsule or an injection or an infusion of some sort. You're going to get a prescription for a living human drug. A human cell is going to be your prescription. And here's why. Because if you take a drug, a medicine, that for the most part just interferes or works on one biochemical pathway in your body, right? Maybe a couple if you're lucky, but for the most part it does one thing. Cells know what to do. By some estimates, every cell in your body right now has about, I'm trying to remember the number, it's somewhere between 30 and 50 billion chemical reactions every second in every cell in your body. And so if you put a cell in the right environment and turn it loose, it knows what to do. It looks around and goes, you know what, I know how to cure this and how to readjust and stabilize whatever it is that it's doing. So a cell can have multiple effects because it'll secrete hormones called cytokines, and all of that is a way to either get rid of bad things or help heal things that need healing in the body.
And now we could probably do a whole entire hour on this, but we have to keep it moving along. But I'm going to have you back sometime to discuss that more in depth. I promised people we would tell them what your legacy would be, because we'll have you back to talk about stem cells. And someone once asked you that.
And I don't remember
You
what
didn't remember
I don't
the
remember
answer, but I did.
What? Give me a hint.
You said helping people and
That's where I was going to go,
a
actually.
sense of humor.
Yeah.
Those were two things that
people
you
think-
wanted to be remembered for.
A lot of people say I'm a funny guy. Most people don't realize
They
that.
don't know that, though, because they only see you as Dr. Max. Right. I know the other side, and yes, I would agree you're very
I
funny.
spend a lot of time helping people, and that's really what I want to, I guess, be remembered as somebody who spent a lot of time both on television and individually, personally, helping people.
Well, that's a wonderful legacy to have. And you're going to help me right now because our next guest is coming out. And it kind of a surprise because I don't think we can do a health segment today without talking about the coronavirus, which we glazed over in the beginning. But she's going to tell us how traditional Chinese medicine is being used. There are clinical trials going on. So it's not just, let's get you a chair and a microphone.
Your microphone.
Thank you, Cheyenne.
I don't want you to drop
Thank
it.
you.
There you go.
Great. Great, thank you. And I loved what you were talking about. I really did. And also about the medicine. My father was also a physician, and he was old style of really palpating and looking at people and taking their time.
Yes,
And,
old school.
and that's really what's missing is
You
that
can learn a lot by
patience
doing that. Yeah.
I remember when
Yes.
doctors came to the house with the big black bag and they opened it, and if you
That's
had
right,
a fever,
house calls.
yes,
house
I loved
calls.
that. I
Yeah, we
loved
used to have
that.
Doesn't happen much anymore.
a sign on the car, doctor on call. Okay, great.
Slide
Okay.
over.
Well,
How's that?
I'm actually really excited to be here. And again, as Dr. Max had said, there is not a vaccine yet.
Right.
And really, vaccines, what they are alarm systems to tell your body to heal. But if somebody has a weak immune system and isn't taking care of themselves, a vaccine is not going to help, and that's why people that are weak in health, underlying conditions, are more susceptible to having severe responses.
I actually think that's the key to all of this, that all of the fear, being manufactured by media, that 80,000 of the cases are mild.
Yes.
So the ones that aren't, the 14% that aren't, if they build up their I think building up the immune system and preventing it in the first place is key to any type of influenza
Yes.
and flu, right? I mean, Dr. Max, you can.
And there are probably, we know how many people have shown up in the hospitals
Sure.
with coronavirus, right? And there are a number of deaths. What we don't know, and what is probably the case, is that there are probably many, many more thousands who've gotten sick, and their immune system, as you said, was strong enough to
Sure,
fight off the
yes.
virus, so they're not ending up in the hospital or they're not dying. So
Right, so
a
that's
strong immune system
exactly
is good,
always,
no matter what.
always,
And so far, the washing of the hands is the best advice, and keeping your immune system strong. But I've never seen. Let's go through
Okay.
these. What do you have
So,
here?
as I had sent to you some of the information about some of the Chinese herbs that were actually in some NIH studies and were used in conjunction with antivirals for things like SARS and the H1N1. And some of them were, this is honeysuckle.
Okay.
And that has a lot of properties for like sore throats. And you can actually
and you
make
put that in tea.
you can make a tea out of it. It
Okay.
actually smells great. This is lily bulbs also. That's for like cough, for like dry cough.
Oh.
These are reishi mushrooms, and there's a lot of research on mushrooms. Mushrooms are considered a superfood.
Wow.
And anti-cancer properties.
Same thing with the mushrooms. Putting it in tea.
Yeah, well, and these they can be ground. So these are the large dry ones. Oftentimes they're ground in a tablet, or you can soak it and make it into a tea.
Okay.
Or often like these things you can actually cook with. This is astragalus, which is also this you might put into more like a soup, or it needs to be kind of
Interesting.
disseminated, and that also has a lot of immune supporting properties. I put here also the ginger. Now, ginger is great for stomach problems. Together with something like lemon and honey is great for throat. It's used a lot with nausea. So someone who has underlying illness and difficulty eating, you have like ginger in a chicken soup or ginger tea is going to actually help their digestion.
So
You
basically,
see ginger all the time in sushi.
Yes.
Sushi
Oh, yes,
restaurants
yes.
are always getting a little ginger
Yes.
to help.
There's a little
Clear
bit
the
of
palate.
exactly, and actually something like orange peel is also something that helps with like digestion and greasy food. And so you'll see it in a lot of like the cuisine of something like heavy meat, and then they'll
Right.
have like an orange chicken or orange beef, and it's really
Yes.
to kind of help with digestion. And then
are
the
these little guys?
chrysanthemum.
what do you do with that?
This is a chrysanthemum is a tea. You make it into a tea. And that also is for like heat or sore throat.
Soothes the throat. Really?
Yeah.
It looks
Okay.
a little like chamomile, doesn't it?
Yes, exactly. So these are the baby ones, and then you can actually find them, and they're actually larger, even sometimes much larger,
okay.
and it's very sweet. It has a sweet kind of a flavor, and you can smell the honeysuckle.
Neat.
It sounds like a lot of these things are based on de-stressing. Keeping away that fight or flight response that releases all of those negative
De-stressing is always a good idea, no matter
Right,
what.
de-stress, exactly.
Exactly. The
Right?
fight or flight.
Is there anything
actually
else?
is-
The fight, right? Anything else? Cortisol is what I was
It's the
couldn't think of.
cortisol,
Yeah, you
yeah.
want to keep cortisol away.
Yeah. Well, it's something that is a regulator, but too much stress, then you have a lot of cortisol, and it's not really
Right.
helping to reduce inflammation.
This looks like ginseng, though. Is it related?
This is actually ginger.
This is
It's a
ginger,
root.
though.
Yeah, this is a ginger. It's a root. But yeah, ginseng is also a root. I didn't. I
Looks like it, though.
Yeah,
doesn't
yeah,
it?
similar. They call it like the ginseng would be considered. They call it a man root because it looks
It's
at the
like a little
shape.
body for
Yeah,
that.
and just as an aside, roots tend to be more tonifying for like kidney. We call kidney energy like your deeper energy.
Right.
So by the shape, something that's floral tends to be going towards the nose, like the upper part of the body, and then you have so the various parts of an herb will go to particular. They're like a messenger to different areas of the body.
Interesting. And the chief scientific officer of the World Health Organization did say that they are testing this with the same rigor in science as
Yes.
pharmaceuticals now. So it's nice to have them acknowledge that this traditional Chinese medicine isn't just frou-frou now. They're actually doing legitimate scientific studies. Do you feel good about that? We have about a minute.
Yes, absolutely. I feel
Yes.
really good about it because there's thousands of years of
Right.
empirical evidence of herbs working, and then it's just really a matter of looking at the Western model to kind of give it the the stamp of approval. But it's still it still is working. Whether it has the stamp of approval.
There used to be a school, I think, of Chinese pharmacy or medicine downtown here in New York, and they actually had a pharmacy that you could go to, and they would have traditional Chinese herbs.
Absolutely.
I don't know if it's still there.
There,
It's been a
there
long
are
time.
a couple of acupuncture Chinese medicine colleges in New York, and but also my friend who is Cam Wo, and he's on Grand Street, and he's also a pharmacist, and it's 3 generations of herbal medicine, and so if someone wants to take herbs, they should probably speak to someone who would also help them because.
You don't
It
wanna-
depends on who it
You
is.
don't want to
It's not-
freelance this because you might.
yeah, and
Right.
also you don't want to start taking medication. Like this is powerful medicine, so you don't just like let me just take everything because it could be not so great.
Right. Well, give me the name of your integrative
Integrative healing arts, yes.
on 14th Street in New York City.
In Union Square,
Union
16th,
Square,
yes.
16th Street
Yes.
in Union Square. And Max, your book sales are the new cure. MaxGomez.com.
Yep, or you can get it on Amazon.
Or
Just like everything else
Amazon.
in the world, you can get on Amazon.
Thank you so much for being
pleasure.
with us. Thank you so much for being with us, and thank you for being with us. A shout out to Dr. Imran Ali. He said he loves Dr. Max.
Thank you.
Yes, you have one fan. Just kidding, you have thousands. Thank you, everyone, for joining us. Be sure to like us and follow us on Facebook, and stay healthy, everyone. We'll see you next time.